Assalamualaikum and hi. So today my group is going to present a problem-based task for embedded Internet of Things, and my group is consists of NURUL KHAIRALL and Nureen me, and SYAZANA AMIRA. So I'm going to lead this presentation with the first part, which is introduction. So for the introduction, um, coronavirus are a type of virus that can infect human and cause respiratory disease, and they are named corona because the virus surface has crown-like spikes. And coronaviruses also cause sickness in humans, include SARS, Middle East Respiratory Syndrome, or also known as MERS, and the common cold. And COVID-19 is a novel coronavirus strain was initially discovered in Wuhan, China in December 2019. And since then, the virus has spread to every continent until now, and the number of those affected fluctuates on a daily basis. And the person that has been affected by this coronavirus is not is very ramai, and over 4 million individuals have died as a result of this disaster, and it is also has been reported in 192 countries and territories across the globe. And the technical accuracy of the diagnosis and procedure is what determines quality in the healthcare industry, and only healthcare practitioners have access to all of the data in most cases, while functional quality refers to the healthcare service delivered to the patient and is a measure of the patient's satisfaction with the service. And in this example, the hospital offers a variety of services to its patients, and many patients nowadays suffers from illness due to COVID-19 symptoms, and doctors must devote more time to monitoring their patients' health metrics, such as their body temperature and so on. However, it is difficult for the doctor to keep track to all of the patients in the hospital. So as a result, we are introduced to technical breakthroughs in order to simplify all of our tasks and save time. For the next one is problem statement. The existing temperature scanner on the market is ineffective since it cannot be reliably monitored from afar. So people had to manually put in their information because the current contactless temperature scanning device didn't have an automated tracking option. So the entire process of temperature screening and the data collection takes a long time and frequently produces congestion, increasing the danger of virus transmission. In the event of an infectious illness epidemic, a contactless temperature scanning system with data logging is critical. Before entering a premise, the authority of the premise must follow the law enforced by the government to record facts such as body temperature, check-in time, and date of the individuals. In addition, the government has developed an application called MySejahtera for contract tracing reasons. However, only the Ministry of Health, not the premise authority, has access to all of the data gathered. As a result, a contactless temperature sensor with data logging capabilities is required. And for the objective, the main goal of this project is to create smart body temperature scanner with cloud system using commercially available low-cost microcontroller modules and sensors. The following are the breakdowns of the main goal, which is to build a low-cost smart IoT temperature scanning system, and then to get the insight of temperature faster, and to automate and record data from the IoT smart temperature scanning system. And that is all from me. So QAMARINA will continue this presentation with the next part. Thank you.
Hi, my name is Nurul QAMARINA. So I will continue with the scope. So it can be used by the public. Okay, so for the project significance, first, the creation of this invention will be impressed by its quality. This study will elucidate how this invention works to facilitate the affairs of all parties that involved. This study will give awareness how important IoTs in the community, especially when technology requires a high cost of manufacturers. Through the analysis made by this study, many people will realize how IoT simplifies daily affairs without having to exert a lot of energy and time. And the last one is the overview. Presented in this study will push to the new generation that will create many more invention in future and be able to help community. For a literature review, comprehensive monitoring of infected individuals and the development of the disease surveillance system are particularly important during the outbreak phase. The health monitoring system built with the Internet of Things technology, cloud computing, and big data analysis can be provided to the centers for DCD to prevent, predict, and monitor new infectious disease. Integrating smartphones with the IoT and creating a monitoring system suitable for pandemic prevention, medical treatment and healthcare will be very helpful for self-care and infectious disease outbreaks. Healthcare sectors in various countries often use remote health monitoring system as a reference for disease prevention, infection prediction, and emergency decision making on infectious disease. And the last one is this study purpose the IoT intelligent pandemic prevention, temperature measurement, and pandemic prevention situation analysis system. So next, SYAZANA gonna take over this presentation.
So my name is SYAZANA AMIRA. I will continue course planning. This project menggunakan 9 item iaitu Arduino Uno R3 dengan kuantiti hanya perlu 1 dan harganya ialah RM22.90. And then item yang kedua kita menggunakan resistor iaitu kuantitinya 1 and then harga RM1. And item number 3 potentiometer, kuantiti juga hanya 1 dan harganya ialah RM1. And number 4 item PIR sensor, kuantiti juga 1 dan harganya ialah cuma RM5.90. And item number 5 temperature sensor, kuantitinya juga ada 1 and price-nya ialah RM4.50. And item number 6 piezo, kuantitinya juga 1 and harganya cuma RM3. So item number 7 LCD 16 kali 2, kuantitinya juga 1 dan harganya RM19.90. And item number 8 breadboard, kuantitinya 1 dan harganya cuma RM3.90. The last item is kabel. Kami menggunakan kuantiti kabel iaitu 20 dan harganya cuma RM1.90. And then the last one is conclusion. There are the 3 main conclusions that can be drawn from this project. First, the development of the device exhibit a full working system. Objective to develop a hardware prototype for a temperature monitoring system. System operating on sensing principle appropriate placed in a medical institution such as a private clinic, government hospital can even work from home. It is also suggests that by using the instrument, people can save their time to do body temperature check to find out the result of normal human temperature level. Indirectly, this demonstrates the merits of the proposed system to make health and health demands. Second, the device developed at that wireless technology, which is allow user to view body temperature result at any time on the temperature scanner cloud on the smartphone. Third, it can be seen the machine proposed a new prototype for a medical instrument that could be used as a medium for telemedicine application. Furthermore, this instrument has the potential of for improvement feature. So that's all from us. Thank you.